In the UK, overweight and obesity is now the biggest threat to public health. Excess weight increases the risk of cardiovascular disease, diabetes and cancers. And with a rapid surge in childhood obesity over the last 10 years, we're now seeing these complications much earlier, sometimes before children start school.
In Waltham Forest, over a quarter of 5-year-olds are considered overweight or obese, and by year 6, almost 38% of children have excess weight, which is higher than the national average. This is a serious concern, and we're looking to the whole community to get involved. One of the best ways to prevent excess weight gain is to help children and their whole families develop healthy habits as early as possible.
In Waltham Forest, we'd like to see all staff who work with children and young families taking every opportunity to provide practical support and advice to parents around healthy eating and physical activity. We'd like them to be signposting them to local parks and other services to help them stay healthy, and also to promote healthy eating and physical activities in sessions wherever possible.
What research has shown is that the earlier we start, once they at the weaning point, the weaning stage, we introduce a wide variety of healthy foods, and that in itself ultimately will instill in them healthy eating habits. And that's the main aim, really. Well, they should be eating foods from all the food groups, and mainly the carbs, the fruit and vegetables, the protein, and from the protein you get your calcium and so on. So once they're having that, and of the unhealthy stuff, the sugary and fatty foods, high fat and sugar foods, those are the ones that we ask parents to limit. But the others, that's what we, in the right balance, that's what we promote for healthy eating. So other tips for eaters would be, when we encourage the family model, then we not only are they eating with the family, but they're partaking of family foods. Because from 1 year, children can eat family foods. So because they don't like to be different, they want to eat or try what's on your plate. And that's a good way to get them. They don't want baby food. After 12 months, no baby food, just what the family are eating.
In addition to staff having a good basic knowledge of nutrition for young children, it's important that all settings work to a policy for providing food that is safe and healthy, and to ensure that all nutritional advice given to parents is correct, consistent and helpful. We've developed a sample food policy for settings to use. You can find this in the early years foundation stage area of the Hub website. As well as being hugely important for development, physical activity is also a key part of maintaining healthy weight for young children, and the rest of us for that matter. Children are naturally active, however our lifestyles have changed with the proliferation of technology, and most preschool children in the UK don't get enough physical activity. The Department of Health has developed guidance to say that children of preschool age who are capable of walking unaided should be physically active for at least 180 minutes, spread throughout each day. Under 5s should minimise the amount of time being sedentary. So this means that parents and carers should reduce the amount of time that children spend watching TV or playing on the computer. In Waltham Forest, there are a large number of free activities for children, such as swimming. For a full list of activities, check out our local council website. While diet is key to healthy weight, it's important to note that it may not provide all the nutrients that growing bodies need. Sunlight's the main source of vitamin D. However, in the UK, most children don't get enough sunlight, and this can affect their development of healthy bones. For this reason, it's recommended that all children under 5 are given a multivitamin containing vitamin D. So, to recap the top tips for healthy weight. Promote healthy eating to all families. Ensure food on offer is healthy and nutritious, and that all staff are able to offer basic support and advice to parents. Get a good food policy. Ensure that your centre has an updated food policy and that all staff are aware of it. Help every child to reach their 180 minutes every day. Ensure that activities in your centre help children to be more active and less sedentary, and help spread the message to parents. Don't forget the essential vitamins. Encourage all parents to give their preschool child a supplement containing vitamin D until the child turns 5. Get to know your local children's centre and health visiting team. Through clinics and regular health promotion sessions, these providers are there to help all preschool children stay healthy.